Okay, so my name's Morgan Ray. I'm the admissions coordinator here at Flathead Valley Community College, and I'm going to be helping kind of moderate today's session. We have a couple people who joined us today to be able to answer your questions about why you should go into healthcare office management and kind of the potential and careers moving forward. So Brenda, if you'd like to introduce yourself first.
Sure. My name is Brenda Rudolph, and I am the program director at Flathead Valley Community College for the Healthcare Office Management program.
Okay, and John?
Yeah, so John Pavarini, I'm the practice manager at Kalispell Regional for our pediatric subspecialty clinics based with Montana Children's Hospital.
Perfect. Tammy, if you could go ahead and introduce yourself, please.
Yes, I am Tammy Hindman, and I am the practice manager for women's health care. I manage a GYN gynecology practice, a midwife clinic, and also a Montana Children's maternal fetal medicine.
Okay, so if we could go ahead first and talk a little bit about how you came to be in the field, just to kind of show students that there can be a lot of different ways you come into healthcare office management. Brenda, if you could go first.
Well, I came into office management. I actually started in office management type of skills in high school. So I've been in this for a few years. And as my career progressed as a teacher, I have become a teacher of healthcare office management. And it's something that I've really enjoyed teaching, but it's also very rewarding to be able to place students in a lot of different jobs. And so I think the need for this kind of worker is great.
And John, how did you come into it?
Yeah, so I was really kind of started, I was a camp counselor actually at a camp for kids with serious illness. So I mentioned in my introduction, I do pediatric clinics. So I've worked almost 10 years in just pediatric clinics and hospitals. But how I got into that was I knew I wanted to work in the medical field. I found that when I was working with kind of in a healthcare type setting, but I knew I wasn't a nurse or I knew I wasn't going to be a doctor. So how else do you work in healthcare? And I think a lot of times people don't remember that in hospitals and clinics, there are office managers like myself. And, you know, we're kind of a piece to the puzzle, and you don't have to just be a doctor or a nurse or a medical assistant to work in a medical office. So I found my path that I wasn't going to be the hands-on caregiver, but I was going to be an administrative component of delivering healthcare and medical care.
Wonderful. And Tammy, how did you come to be in the field?
I came into this because of my mother. She worked at Kalispell Regional Healthcare for over 30 years in administration. And so in high school, I had some opportunity to work as a PRN employee in a couple different clinics, just kind of filling in, and also in college. So it gave me some experience, and it was something that it's a way to take care of patients, people in our community, and I'm definitely not one that would want to be drawing the blood or handling the hands-on medical, you know, like emergency situations. That's just not something, like John was saying, that's not for me, but I definitely feel like I'm helping patients by doing what I'm doing and helping train and lead other staff members.
Wonderful. So Tammy, if you could go ahead and tell us, what is the proudest or coolest moment of your career? Have you had any crazy stories or anything fun happen?
Yeah, I mean, and I thought a lot about that. I think the biggest thing for me is the proudest moments is when I have employees come back and, you know, years later and thank me for their experience that they had when we worked together. That is a very proud moment for me. That also, I guess, helping patients to navigate their care. I like to say that I'm a very hands-on manager when I can be. I know it's changed through the years, but helping patients either financially navigate and get the care they need, whether that's helping them find insurance or finding the right provider that's going to take care of them. So I think those are the two that means the most to me.
Awesome. John, what about you?
I think the coolest piece for me is to interact with patients and families, and those patients being children. I think kind of seeing the smile on their face and the enjoyment they have in coming to sometimes the clinics and a hospital setting, having worked at other children's hospitals. I recall one distinct memory. It was a long time ago now, but a kid was walking through the hospital and just said, "This is the coolest place ever." And when I think back to myself, I don't want to go to my doctor's office. I don't want to have to go to the dentist. That's not enjoyable for me. But to be part of the creation of an environment or a culture, an atmosphere that kids truly love and enjoy. And then ultimately the impact that has not only on the patient, but the families. I've also seen it come full circle where people have come and worked for me or in a clinic setting, and they were once a patient of either that clinic or that hospital. So to kind of see that roundabout way where the office, the clinic setting and a hospital setting really, impacts young children, and they remember that, into adulthood, and sometimes inspires their own career. So to be part of that, creation of that culture and environment that patients remember and ultimately want to work for it one day is super cool.
I love that. Brenda, what about you?
Well, I come at this from a little different perspective in that I'm actually training office managers, and it is very rewarding for me to be able to have a student come into my program and be able to place them in the healthcare in a career. But in addition to that, it's also very rewarding for me to have employers call me and want my students to come and work for them. So I kind of have two things going on and with my program.
That's wonderful. So then, Brenda, what would you say is a critical trait or skill that's needed for a student to be successful in this career?
You have to have really good soft skills. You have to have good communication skills. But in addition to that, you also need to know the lingo or the language of the medical office, because this is a whole different language. When you walk into these offices and doctors are speaking to you, you need to be able to understand what they say. And then there, of course, is the issue of insurance. And I think you need to have some good background on how insurance works.
Tammy, what else would you say are critical skills in this area?
Yeah, communication. That's one of the top for me. Also, remaining calm. As a practice manager, I mean, I've fixed toilets, helping a staff member take care of some things at home even to help them to come to work and to be successful. Also, leadership and motivational. These are really trying times, and patients will come to our office stressed about their medical concerns, and even their family members may come to our practice that way. So remaining calm and motivating our staff to be positive and to have an understanding of what fears our patients are sometimes feeling.
Mm-hmm. I think that's huge. John, what else would you like to add?
Well, I'll definitely continue the trend in that communication and building relationships with people very quickly is very important, to establish trust. And really modern day, a lot of us are texting, emailing, a lot of it's electronic, but that still does not replace the getting up and walking and finding someone and talking to them face to face. So as Brenda said, as Tammy said, kind of those soft skills, really being able to approach someone, ask questions, admit that I don't understand that. We talked about the medical terminology and not knowing it. I don't know everything still to this day. And if I don't understand, being able to say, hey, what does that stand for? What does that mean? Help me understand that. So building that trust. And again, also going off something Tammy said, being willing to do whatever the day asks of you. I have, taken dirty diapers out of trash cans and thrown them out back. And there was no textbook or educational or academic class that taught me about that. And I'm not a parent yet, so I don't deal with dirty diapers very often, but I definitely had to do that. And, just being willing to step up and help out where needed. There's no set job description for office managers, not necessarily. There's always other duties as assigned, and being willing to step in and help when asked.
So that actually kind of leads to my next question. You said that, you know, it's other duties as assigned, right? We make that joke all the time. John, what does an average day look like for you? Like, what tasks do you do? What can a student, someone who goes into this, expect to have their life look like?
Well, I think, you know, you always have to start every day at, you know, what are we ultimately trying to do here? And that is deliver care and get patients in the door, see their doctors, get the medical care they need, and then go home feeling satisfied with, you know, what follow-up steps they need, or hopefully they never have to come back again. So keeping that on the forefront in mind, but any given day, you know, there's scheduling issues, you know, patients not showing up for appointments and trying to keep everyone busy. And then, you know, especially given the year we've had, we have people calling in and they can't come to work today because they're not feeling well or have various symptoms. So, you know, working with staff to make sure everything's covered, tying it all back to delivering care effectively and efficiently, so that these patients are happy and satisfied with what they're getting. You know, we can't shy away from the fact that paying for healthcare can be very expensive sometimes, even with health insurance. So, you know, putting those patients first is kind of what my day consists of, and tying it back to that. But answering questions, being available, you know, I mentioned talking face to face is important, but my cell phone's ringing all the time with, you know, doctors calling me, with other areas of the hospital calling me, just coordinating care. You know, there still are a lot of emails and meetings, but that's how we make forward progress and get things done.
I love that. And Tammy, what does a day look like for you?
Yeah, so I mean, one of my clinics, we huddle every morning. We take a 15-minute huddle, and it's just to kind of say who's assigned to what doctors, what problems do we maybe see in the practice with the visits, the way they're scheduled, as far as do we have all the medical supplies we need for that to be successful. So we kind of problem solve a little bit first thing in the morning, and then we take off for our day. And it's changes. I mean, I would love to say that I can, you know, I'm going to do exactly the same 10 steps every day, but it varies based on the staffing needs. Are we fully staffed to support our doctors today? Do the doctors have everything they need to take care of the patients? Lots of phones, lots of communication, working with patients that are struggling paying for their bills, patient complaints. You know, I mean, earlier we talked about proud moments. I work in a field that, you know, I'm very proud of, and we get a lot of recognition. Patients are very happy coming to our clinics, but there's those times when it's a struggle, whether it's just, like I said, a patient just being more concerned about her health care and emotional. So, you know, we have to have those conversations to try and neutralize situations. Obviously, financials are a big part too. You know, budgeting for our departments and making sure that we have, that we're looking forward and what our needs are going to be, and then being able to afford those. Yeah, team building, continual. I mean, rounding with our staff every day, that face-to-face is so important. And education.
Perfect.
I'm sure there's a lot more.
Right. It's that joke of other duties as assigned, like the day could go on and on, all the different things people do in a day. Brenda,
Yeah.
anything you'd like to add?
No, obviously my days are different because my students are going to school, but I'm really happy to hear about some of these things that you do, because we do team building skills, and we do some of these office and soft skill role playing that you have suggested. So I'm happy to hear that it's going to be very helpful.
So Brenda, then what does it look like for a student who's in the program? What does their day look like? If a student's going, say, do most students go full-time or that kind of, what does the student aspect look like?
Right now, most of my students are going barely full-time, at least half-time to full-time, because most of them are working. So I have a lot of students who work during the day and take classes either online or via hybrid. And so they're doing a little bit of both. And this profession has been asking a lot for the workers. So my students have been able to be placed before they graduate. And so I'm happy that they're still interested in graduating. It's important that they complete the program.
Mm-hmm. Would you say then that what are some of the challenging aspects of the training or the education? Like, where do you see your students struggling?
My students struggle the most with anatomy and physiology. It is a requirement of the program, and it is a difficult class, but it is also really necessary information for them to be able to do what they're going to be doing. And so that's probably where my students struggle the most, is with that specific class. However, there's so much help on campus, and the A&P instructors are awesome. Mm-hmm. And so they have helped students through these classes for many years. So it's not something that can't be done.
And that was actually something similar to what John was saying about knowing the terms and having to ask clarifying questions. John, what would you say is the most challenging aspect of your job?
Yeah, I would definitely say that. I think healthcare is a revolving, or not revolving, but a changing field. Healthcare and hospital management and clinic management was not the same 20 years ago, and probably will not be the same in 5 to 10 years from now even. That is influenced by the state, the country, just the populations and where you live. So the challenge is keeping up with the times. And the biggest piece with the training and education is you can go through coursework and classes, but the learning doesn't stop there. I still read journals. I still read articles as they come out. So you are constantly learning and growing. And if you don't, you'll fall behind in kind of the field. And the only way to keep up in those conversations is to stay as current as possible. And you can't read everything. And I know, people want to take some classes and be done with education, but that training and education continues. And it's a lifelong, commitment to learning and growth in healthcare. So it's a challenge, but it's equally rewarding if you commit to it.
I've also found that when you enjoy what you do, it's a lot easier to continue to learn in it. Like, you enjoy that continuing education. Tammy, what would you say is the most challenging part of your job? And it looks like you're muted right now. Okay.
Okay. So I would say the same thing. I mean, it's challenging. It's ever changing. It will always be. It's interesting during this pandemic that we've gone through that, I think we've faced so much change, and rapidly. I mean, from the beginning in March, it was daily to weekly. Now it seems like change is happening, maybe monthly, actually more often than that. But that is, to be up on it, to be current, to help support your staff, and so that they don't feel stressed about it. I think that's really helpful for a manager. During our more specific, like what's happening right now, is I think what's been most challenging for managers is having enough support staff and making sure that they're healthy. Medical supplies during this pandemic has been very challenging at times to get what we needed in our facilities. And then again, trying to keep up that positive energy and having our patients and employees feel safe. So.
Yeah, I think that's huge. So we do have our Q&A. If there's anyone who has questions who's on the webinar right now, feel free to drop the questions in the Q&A and I will answer those. And I'll ask them out. But if you guys don't have questions, I've got a couple more. Well, we've got just a few more minutes. So if you have questions, drop them in the Q&A. Otherwise, I just want to know, Tammy, what would you tell a high school student interested in going into this field?
Well, a few things. One, the soft skills. I think we don't think there's a lot of focus on that in high school, but I think it's real important to recognize them. Like we talked about earlier. Also, the financials. There's lots of, we need to know our financials. So accounting. I also think that, that's really, I think, the biggest things. And opportunities, if you can get an opportunity to volunteer somewhere, to know if this is a field you really want to work in. Because, I mean, I find it so rewarding because I'm giving back how I can. I'm supporting my doctors who I knew are giving excellent patient care. So I would suggest that volunteering in the medical community, medical field if you can, financials, accounting, also just working on relationships and communications, understanding different personalities too.
Thank you. John, what would you say to a high school student interested in this area?
Yeah, if you're interested in this area, I would really encourage kind of start mapping out kind of, how you want to get placed into healthcare, find your, the first foot in the door. We're talking about our roles now, but I was not an office manager right out of school. I did not get hired into this position. I had to go through several steps, and some of those are the best career decisions I ever made was, I went through a CNA course. I never actually was a CNA, but I knew I wanted to get integrated into a hospital somehow. So I took a certified nurse assistant class and, went through that training, and I did the clinical practicum. So I was hands-on working in healthcare. Tammy mentioned volunteering. I volunteered a lot of times, not only in high school, just to get exposure, to see healthcare, to see different clinical areas. And then ultimately my first job was an administrative assistant at the hospital. It was not an office manager. So if this is something you're interested in, understand that there's going to be steps along the way to get there. And then, what area do you want to land in, or how can you learn outside of the classroom? How can you get hands-on exposure into that? And then ultimately finding that passion and running with it. I've constantly set goals throughout my career where I want to be in 2, 3, 5 years. And those are going to continue to progress. I'm only 10 years into my professional career. I'd say I got 30, 40 years left before I can seriously consider retiring. So it's a changing environment, but set those goals and, find out what you're passionate about. And really work towards those and pursue all opportunities that offer learning.
Okay. And Brenda, what would you like to add? We've got 2 questions I want to make sure we have time for. So I know you talk to students all the time.
I talk to students all the time, and I'm really happy to hear them say that this is a growing, changing field, and you're going to need to continue your education. And also, I want to reiterate the point that through the educational process, we do have opportunities for either volunteering or job shadowing or internships, and now we have apprenticeships. So we have a lot of different opportunities for students to get their foot in the door, and that's a really nice way to begin. And secondly, I'm also very happy to hear John say that you don't start out being an office manager. Sometimes you may begin with a medical receptionist duties, but then you'll grow into that position after you've earned their trust. So it's something that evolves over time.
So we'll real quickly, Brenda, it's a little different because you are the director of our program, but what type of degree do you have?
I have a business degree. My background is accounting. So I have a degree. I have a degree in accounting education. My master's degree is an MBA, and then I am a medical coder. So I've gone through the medical coding training, and I have done a lot of office management training aside from my degrees.
Okay, and John, what is your degree in?
Yeah, so I do have an undergraduate 4-year bachelor degree, and that was actually just in psychology. So that's why I kind of had to find my way into healthcare. It wasn't a hard healthcare 4-year degree, but once I got in, I worked for 4 years, and I actually earned my first supervisor job. And then once I was in my supervisor job, I went back and did get a master's in business administration. So that's a commitment and can be a financial investment, but it was not required for me to reach kind of an office manager, office supervisor role to get, but I now have an MBA.
Perfect. And Tammy, what is your degree in?
Yeah, mine is associates. I got an associate's degree at FEPC many, many years ago in business and accounting, and that was my direction that I wanted to go. My education has been pretty fragmented. I then became a stay-at-home mom with 4 children and became a cosmetologist. So at that point, I started continuing my education, knowing that I wanted to get back into the medical field. it felt more secure to me rather than being self-employed. So then I started back taking courses and coding, more business classes. So that's, yeah.
Yeah, I like that. I like that.
And management classes through Mgmt as well. Just different trainings along the way.
I like that. I like that you've kind of seen a little bit of everything as well. Okay, so we have like 2.5 minutes left. We have to end on time. So if you guys could each give me the 30-second, what is the hardest part of your job? John, why don't you start us off?
The hardest part is definitely being adaptable to change. As we've seen with this recent year, and this isn't just true for healthcare, it's probably true for all professional environments, but being adaptable to change, learning to kind of process that change and understand why it's taking place, and then moving forward. Day in and day out, things are changing, and we set processes, but now they have to change. And getting on board quickly and accepting those will really make you successful.
Thank you. Tammy? What
Yeah, to be honest, I don't really, the worrisome, I guess all the change that we've gone through has been definitely challenging. I guess the biggest thing for me is always making sure the staff is working well together and they're a strong team and that they're taking care of each other. So that's what keeps me up at night, is worrying about my team, because if they're not in a good spot, then they're not as successful when caring for patients. So I work a lot in team building with that. So that's really huge to me, and that's something that I worry about.
Thank you. Brenda, what would you say your students struggle with the most?
Well, I would say, adding on to what both John and Tammy have said, and that's keeping up with the change. Healthcare is changing always, and staying on top of that is really important. It's also really challenging.
Thank you. So that is time for us. I did want to say, if you are an attendee and you have questions, you're more than welcome to email those questions just to the college, and I can redirect those as we need to. So if you have questions for Tammy, John, or Brenda, and you'd like to follow up with them, just email info@fvcc.edu, info@fvcc Foxtrot Victor Charlie Charlie, and I can get those redirected if you guys have any questions. Thank you everyone for joining us today. We really appreciate it. Thanks, John, Tammy, Brenda.
Thanks, Morgan.
Thanks. Bye.
Thank you.